Welcome to the sixth installment of the monthly series, Who's Leading the Leading Health Indicators? Each month, this series will highlight an organization that is using evidence-based approaches to address one of the Healthy People 2020 leading health indicator topics. Before we hear from our speakers, let me give you some background on Healthy People and the leading health indicators. For 4 decades, Healthy People has provided a comprehensive set of national 10-year objectives that have served as a framework for public health activities at all levels and across the public health community. Often called a roadmap for national health promotion and disease prevention efforts, Healthy People is about understanding where we are now and taking informed actions to get where we want to go over the next decade. The leading health indicators, the focus of this series, represents critical health issues that, if addressed appropriately, will dramatically reduce the leading causes of preventable deaths and illnesses. These indicators, or critical health issues, are linked to specific Healthy People objectives. They've been selected to communicate high-priority health issues to the public, along with the actions that can be taken to address them, with the overall goal of improving the health of the entire population. There are 12 leading health indicator topics, and this month we are focusing on reproductive and sexual health. At this point, I'd like to turn the podium over to Dr. Howard Koh.
Thank you, Dr. Wright. Today's webinar is particularly timely because next week on June 27th, the nation is celebrating National HIV Testing Day. So right now, I'd like to spend just a couple minutes reviewing this month's leading health indicator topic, reproductive and sexual health. This topic is a critical area for public health for a number of reasons. First, an estimated 19 million new cases of sexually transmitted diseases are diagnosed each year in the U.S., leading to healthcare costs of some $17 billion. Untreated sexually transmitted disease can lead to serious long-term health consequences, especially for adolescent girls and young women, including reproductive health problems and infertility, fetal and preconception health problems, cancer, and very importantly, sexual transmission of HIV. A second important reason to focus on this topic is that many who seek reproductive and sexual health services do so at clinics and settings that are the entry point for them into the medical care system. So as a nation, we can be proactive by meeting people where they are, covering pregnancy prevention services, prenatal care, and testing and treatment for HIV and sexually transmitted diseases, and also advancing prevention such as screening for intimate partner violence and reproductive cancers, providing substance abuse treatment referrals, and counseling on nutrition and physical activity. And a third critical reason is to advance prevention of HIV transmission, testing to diagnose HIV, and prompt referral to care for HIV infection once it's diagnosed. So knowing your HIV status is absolutely central for treatment and prevention. And in fact, researchers have estimated that preventing just one HIV infection saves about $380,000 in medical costs. On the next slide, we see the 2 reproductive and sexual health indicators, and they are first, that sexually experienced females aged 15 to 44 years receive reproductive health services in the past 12 months, and second, persons living with HIV who know their serostatus. This slide shows new 2009 CDC data on estimated numbers of adults and adolescents living with HIV. That number is now 1,148,200 persons, up from 1,061,100 in 2006. And then looking more closely, you can see that many more men are affected with HIV than women. In fact, the ratio is some 3 to 1. And then among racial ethnic groups, a higher number of black non-Hispanic persons were living with HIV compared to over other groups. And in fact, blacks account for some 44% of all persons living with HIV in 2009. On the next slide, we show the number of persons living with HIV by age and mode of transmission. Of the age groups listed here, those between 45 and 54 had the highest number of persons living with HIV. And among the transmission categories, the highest number of persons living with HIV were men who have sex with men. The next slide shows estimated HIV prevalence rates, that is, numbers per 100,000 by age and race ethnicity. Again, you can see that persons 45 to 54 had the highest rates of HIV infection. And then if you look at the lower set of bars, you will see again that non-Hispanic, Black, and African Americans had the highest rate of HIV infection, while Asian Americans had the lowest rate. In short, there are profound disparities by age and race ethnicity. The next slide gets to the heart of today's discussion, and that is the proportion of HIV-infected persons aged 13 and older who are aware of their infection according to 2009 data. And new data also being released today shows that in 2009, the proportion of adults and adolescents living with HIV who know their serostatus was 81.9%, up from 80.6% in 2006. You can see by that dotted vertical line that the healthy people target for 2020 is 90%, so we have much more work to do. If you look more closely by gender, you see the higher proportion of women know their serostatus compared to men. And among racial ethnic groups, the highest percentage of those aware were white non-Hispanics compared to persons of color. The next slide shows the proportion of HIV-infected persons aged 13 or older who are aware of their infections by age and mode of transmission. And when you look at these 2009 data, you can see that a higher percentage of persons aged 55 to 64 knew their serostatus, some 89.4%, compared to less than half that for those in the age 13 to 24 year category. So we have tremendous work to do, particularly for the younger generation who are at risk or are infected. And then in terms of HIV transmission risk, the higher percentages of male and female injection drug users who are aware are noted here compared to other groups. So awareness of serostatus was lower among persons whose HIV exposure was only attributed to sexual activity, that is, men who have sex with men, heterosexual males, and heterosexual females. And then the next slide shows reproductive and sexual health federal actions. And we are very proud that at the department we have a number of activities that are aiming to increase awareness of serostatus and make a big difference in the future of the epidemic in the United States. Hopefully everybody knows that the National HIV/AIDS Strategy was released by the President in July of 2010. And I personally want to thank Dr. Ron Baldessari, who is on this webinar from our Office of HIV and AIDS and Infectious Disease Programs, who is leading that work for the department. We have a national prevention strategy that has a lot of attention to HIV. Title X family planning programs advanced by our Office of Population Affairs, where we are meeting people with screening and education. A minority AIDS initiative that has been promoting efforts in minority populations in the country since 1999. And then, of course, the HIV testing services and the National HIV Testing Day next week that I mentioned. And if you want to find a site to have that testing, you can go to locator.aids.gov.